we'll do school counseling, but also like some of the students may just come by and drop by and want to talk about something that is on their mind.
好，繼續翻嚟由安樂居呈現嘅不老80啦。嗱，其實佢哋嘅機構咧都會去一啲學校咧，就係幫助一啲學生。咁好多人都會覺得啊，係啊，學生需要啊，因為佢哋讀書壓力大啊，又或者朋輩之間嘅一啲壓力啊等等。咁但係大家有冇諗過㗎？其實可能家長方面都要幫下佢哋，因為家長其實有時都好大壓力㗎嚇。咁啊，究竟如果想去佢哋嘅機構度尋找一啲服務啊、支援等等，需唔需要啲咩特別嘅資格嘅咧？好，呢個時間咧就係繼續請嚟 Angela 咧同你講一講啦。好，其實我知道咧，頭先Angela 你都提過咧，就係話你哋都會同一啲你哋嘅服務都會去到學校度。其實我知道你哋都同好多唔同嘅學校啊，或者非牟利機構啊，或者係社區中心啊，去一齊合作，去令到一啲可能有一啲人本身佢其實係需要服務嘅，但係佢自己又未必會去揾你哋嘅人嘅。咁可唔可以同我哋講講呢一方面你哋啲計劃
？Yeah, so for example, in the high schools, we have counselors that are in all the San Francisco high schools. It's something that the school district and the city public health department wanted to have counselors who are on site. So, school's starting soon or is starting, and so many of our counselors are actually at the school site. Their office is there. They go there like every day. They're part of, in the high schools, they call it a wellness center. So there's like a nurse. That's not RAMS, but there's a nurse that's from the health department. We're the therapists that are on site. And so we may get referrals from teachers themselves or parents who have questions that come in. Because the center is at the school. It's like an office, it's a room, a designated room or space at the school site. We also do outreach at like sometimes they have school festivals and things like that. So we have we'll do school counseling, but also like some of the students may just come by and drop by and want to talk about something that is on their mind.
咁所以喺三藩市都好多學校都有你哋嘅服務係咪？
Yeah, high schools, and then we're also at preschools too. So for preschools,
also preschool,
yes,
幼稚園都有。
Yeah. So also through this city that they fund this program so that and there's other nonprofits too that are in early childhood mental health. So we have certain number of hours that we go to different preschools. So we're in 50 plus preschools in San Francisco. And we do like family parent workshops. We also do workshops for the staff too to learn about like mental health kind of signs. We also do that at the high schools too. And then sometimes we're also like working with the kids directly around different like behavior things that might come up or talking with parents, being a resource there.
嗱，我知道其實可能而家睇緊電視機旁邊嘅觀眾可能都會話其實我都想揾呢一方面嘅幫助。咁佢哋可以點樣做咧嚇？
I think if they're in San Francisco or in Hayward, they can call RAMS. In San Francisco, they can also call the behavioral health department if it's for a senior and the senior is connected to like a senior center. Maybe the senior center already has someone that's there that can provide some like additional support or case management support or make a referral. And same with schools or any other type of nonprofits or community centers that they're already connected. But if they're not connected to anyone, they could also call us directly or ask their other primary care doctor for a referral too.
多謝大家咧，就支持我哋呢個不老80嘅節目。咁大家如果睇緊電視嘅話咧，你又想同我哋直接互動咧，記住可以掃一掃呢個二維碼。咁仲有另外咧，如果而家睇緊 YouTube 嘅朋友咧，記住睇睇下邊嘅資料，亦都可以係連結到我哋噶。咁記得點讚同埋訂閱啦。咁我想知道，其實如果真係想揾你哋嘅服務咧，係咪有一啲資格嘅限制嘅嚇？譬如係咪要一啲醫生嘅 referral 啊，定抑或係收入方面會有一個限制
？So for RAMS, we primarily we're with the Department of Public Health, so we primarily serve those who are low income, who don't have insurance. Also with Medi-Cal, Medicaid. And Medicare. And we have some programs that are like in the schools that we are not necessarily like asking for Medi-Cal. So it really depends on like the age of the person. But I think if someone really just wants to know about what their options are, I think that they can call RAMS or the health department themselves, because if someone's ready to call and ask for help, I think we want to help.
最好都係打電話問一問先，即係唔好自己諗自己夠唔夠竟合資格啦。咁啊，起碼都知道，起碼點樣可以幫到。就算真係有啲咩幫唔到嘅話，都可以轉介你哋去合適嘅一啲機構或者係一啲醫生度幫你哋咁樣。咁所以其實可唔可以就咁 walk in 㗎？
Some of our programs are like place-based, meaning like if you're at the school, then if you're at a school site, you just come in. And then
喺學校度當然啦。
For our outpatient program, you can walk in, but we also still need to work with the Department of Public Health, so they might have to call that too. I do also want to share that if someone does have private insurance, like Anthem Blue Cross or anything else, they have to kind of go through that referral process. So that might be something to consider when kind of thinking about where to go. But I think if someone is ultimately like wanting to know different where to go, they can call RAMS or kind of go back to their primary care and ask for different referrals.
嗱，最後我想問一問咧，就係RAMS 嚟緊長期嘅工作會係點樣啦？譬如嚟緊呢5至10年啊，你哋會有啲咩新嘅計劃啊等等。
Yeah, over the past like 50 years, we've expanded a lot. I think what we still want to stay true to is how do we best help our community. So I think that what we talked about prevention, kind of raising awareness about mental health, I think we're doing more of. We've always been doing that, and I think that's an area that we still want to continue to grow, about raising awareness around mental health. Also providing like the direct counseling support and really continuing to listen to what our community want and how can we advocate for that and work together with our different nonprofit partners and kind of our government systems.
但係頭先你提過話，你哋而家已經去咗東灣嗰邊嘅服務啦。其實係一個好大嘅進展嚟嘅，我覺得，因為其實好少三藩市嘅機構係去咗，譬如第二啲嘅城市啊，又或者第二啲嘅 district。咁所以嚟緊喺東灣嗰邊嘅發展會唔會可能又會擴大咧？
I think it's going to be where we can be most helpful. So the different counties have their existing services. So if we can be of more service to the county, then I think it's something for us as a community, as like the Bay Area, to talk more about.
好，今日多謝晒 Angela 咧上嚟同我哋傾偈，多謝你 Angela。
Okay, thank you so much for having us.
今日多謝晒 RAMS 嘅 Angela 咧上嚟同我哋傾下佢哋嘅服務啦，同埋等我哋知多啲有關呢方面嘅知識。真係嘅，有病咧就淺中醫啦，成日都要咁話啦。咁其實有啲心理輔導啊、傾下偈啊，其實有時咧可能1、2句説話或者係一啲嘅支援咧，就幫助到大家好多。亦都好似譬如安樂居咁啊，都有好多唔同嘅支援啊，尤其是對長者嚟講。咁心理健康方面亦都係有，我哋有啲心理嘅特別嘅專員啦，去幫佢哋啦。其實而家咧，大家知唔知啊？而家老人家咧對呢方面都好開放嘅態度嘅。佢哋又唔開心嘅話，佢哋會直接揾社工啊、揾心理輔導員咧，去話俾佢哋聽啊，究竟我最近係咪有一啲問題啊？點解我成日咁諗㗎？你可唔可以幫我啊？所以咧，時代唔同咗啦，就算老人家咧對呢方面嘅態度咧都開放咗好多㗎啦。